Hello and welcome to The Health Show. My name is Sal DiBella and I'm your host. Like every week, we have a different doctor, and the doctor we have today is Dr. David Brownstein. So he is in my book. I picked him years ago, and I put him in my book because he's very interesting, very knowledgeable about what a doctor should do to help people with cancer and other diseases. And he's a physician. He's an author of 13, 14 books. One of them is the iodine crisis, and the other one is Thyroid, Healthy, and Iodine. And he has a new book, which we're going to talk about in a few minutes. So welcome, Dr. Brownstein.
Thank you for having me, Sal.
You're quite welcome. For the people that don't know you or haven't seen you before, can you just explain to them what your credentials are?
I went to the University of Michigan for my undergrad training and Wayne State University School of Medicine in Detroit, Michigan for my medical training. And I did a family practice residency, and I practice in West Bloomfield, Michigan now, in a holistic medical center, the Center for Holistic Medicine.
Mm-hmm. Okay. Before we start the questions, today I happened to hear the news, and I'd like for you to comment on it. Dr. Oz was in the news today, and there's about 10 doctors that are looking to, he belongs to the Columbia Presbyterian, I believe, Hospital in New York. And because on his show, he talks about weight loss, he talks about not only weight loss, but he talks about what a person should do if they have naturally, the foods they should be eating, for high blood pressure, for everything. And he has a number of conventional doctors, and he has a number of alternative treatment doctors. So I guess they're a little, they're not too happy with him, and they're looking to get him removed from that hospital. So I don't know if you heard that story, but I'd like for you to comment on that.
Well, certainly conventional medicine doesn't like when any physician speaks out against the standard of care. And Dr. Oz has been in the forefront of speaking out against the standard of care in many different aspects of medicine. So I wasn't surprised by the recommendations to kick him out of the, I believe they wanted to kick him off the faculty at Columbia University. I saw the headlines today in the New York Times.
Mm-hmm. Okay. Well, I wasn't surprised. I've been saying all along, it's just a matter of time, because he kept going and going and going, and at the beginning he started off small, but then he started, which I enjoyed, believe me. I like the idea because he's well known and well respected all over. So I'm happy that he did that. And hopefully Oprah Winfrey is behind him, whatever he does. So getting to the first question, can you tell our viewers what a cancer patient could expect when they come to your office as far as testing or whatever they go through?
Well, every patient gets treated the same way in our office. We start off by treating them, as I was taught in medical school. We do a history and a physical exam. And, from that, we order lab tests to evaluate, what we think the problem is or not. And, I do, or my partners and I do what's called a holistic exam, where we're ordering blood tests to check vitamin, mineral, and hormone levels, as well as toxicity levels. And from that information, we try and put the whole picture together, and then we develop a treatment plan for our patients.
Okay. I've heard you say before that usually when new patients come in, they generally are deficient in like iodine and vitamin D3 and a number of other things. Could you elaborate on that a little bit?
So part of my initial visit with people is doing a whole nutrition nutritional evaluation and looking for vitamin, mineral, and hormone imbalances. And you're right, Sal. The vast majority of patients are nutritionally and hormonally imbalanced, and that's been proven from the National Health and Nutrition Examination Survey, which has shown that the majority of Americans are deficient in basic nutrients. And the most common nutrient deficiency I see is iodine deficiency. And we've tested over 6,000 patients in my office, and we found over 96% test for low iodine levels, and most of them severely low iodine levels. And I say that's a catastrophe that's going on right now and has wide-ranging implications for the health issues we're facing today.
Right. Okay, so now if a person is low on iodine, what kind of problems could they have, being low?
Well, iodine's an essential nutrient in our bodies. We can't live without it, and we can't make it in our bodies, so either we get it from our environment or we become iodine deficient. And iodine is required by every cell to function optimally. It's required by the immune system to fight infections, and one of its main jobs is to maintain a normal architecture of the glandular tissue. That includes the thyroid, the ovaries, the uterus, the breast, prostate, pancreas, and other glandular tissue. And when iodine is deficient, this glandular tissue can become cystic and lumpy. And if it goes on longer, these lumps can become hard and nodular. If it goes on longer than that, they become hyperplastic, which is a precursor to cancer. And what we're seeing right now is of cancer of the endocrine tissues, the glandular tissues. 1 in 3 men have prostate cancer, 1 in 7 with breast cancer. Thyroid cancer is the fastest growing cancer in the United States. And this is all related to iodine deficiency.
Okay. Now, when a person, now people that come into you to see you, do you get, that have cancer, do you usually get people in the 3rd or 4th stages of cancer that went through chemotherapy, radiation, and they hear you, or they research you, or they read your book? Do they come to you at that point?
Well, we get a mixture of patients. Certainly we get patients who fail therapies, and we get patients at the beginning of cancer therapies. But cancer is not occurring in such an epidemic across our country because of chemo, surgery, and radiation. It's occurring because we have too much toxicity and hormonal nutritional imbalances. And unless we recognize that, I don't see we're going to stem the tide of this cancer epidemic that's affecting us.
Right. Can we talk a little bit about chemotherapy and radiation? I mean, between a chemosensitivity test and finding out that, this doesn't work, that doesn't work, that doesn't work. Supposedly, in talking to a conventional doctor, he said that it's covered by insurance. So now, why don't you think they give this chemosensitivity test? Do they work by the cookbook? In other words, if you have prostate cancer, you get this. If you have colon cancer, you get this. You have lung cancer, you get that. Is that the way that works?
Well, that is the way it works, but no one has really proven whether doing sensitivity to chemotherapy regimens work either. So these tests are being done for thousands of dollars, and we don't really know if they work. So I'm not so sure that's the best method either.
Okay.
Where we should be devoting our resources is to figuring out why so many Americans are getting cancer in the first place, and trying to stop that from happening. We're devoting too many resources to treatment after someone's already being diagnosed.
Now, naturally, most doctors talk about the food we eat. Years ago, I always thought, and I was told years ago, that the immune system is in the bone marrow, it's here, it's there, in the hip, and here and there. So now I'm finding out through different doctors that I interview that it's really, the gut has a lot to do with your immune system and what the food you eat. So can you talk a little bit about that?
Well, the largest part of our immune system is in our gut, and without a healthy gut, we can't have a healthy immune system. So there's no question that we need to have a healthy GI tract and eat appropriate foods that nourish the GI tract and stay away from foods that inhibit and disrupt the GI tract, such as refined foods and refined sugar and flour and salt and refined oils. And our gut bacteria can certainly become disrupted if we eat the wrong foods and can be enhanced if we eat the right foods. So the first step I take with my patients is trying to help them eat a healthier diet.
Mm-hmm. Okay. And do you include meat, dairy, or meat, dairy, or pasta? And do they cut that out?
Well, I tell patients I've written a book on this called The Guide to Healthy Eating, and in that book I talk about avoiding refined foods, anything with refined sugar, flour, salt, and oils in it. That's the way to start. I have nothing against eating animal products as long as the animals are raised appropriately and the animals are not given hormones and other growth factors, and the animals are given the right food to eat. So there's nothing wrong with animal products, but they just have to be raised the right way.
Right. Well, getting back to the iodine, why do you think the FDA has set the RDA for iodine at least 100 times too low?
Well, the RDA has been set to prevent nutritional deficiency related diseases. And that's all the RDA means. So they want 95% of people to have a minimum amount of nutrients to prevent nutrient-related diseases, such as 70 milligrams of vitamin C, I believe, is the RDA to prevent scurvy. But that doesn't mean that's the optimal amount of vitamin C for us, in particular in our toxic world. And the same holds true for iodine. They've set the minimum amount of iodine that prevents goiter for the vast majority of people, which it used to do before we became more toxic, before we became exposed to such more toxic items in our diet, such as fluoride and bromide. But it's certainly not the optimal amount for people in today's world. And, I've done the research on that, and I've written about that in my book.
Okay. Now, can we talk a little bit about the dangers of bromine? They use it, but believe it or not, when you think back, I remember the baby bottles, fill it up with milk and put it in the hot water, and I would imagine a lot of bromine probably would come out for the baby to drink. Could you comment on the bromine and what the dangers are?
Well, bromine is in the family of halides in the periodic table, and the halides consist of chloride, bromide, fluoride, and iodine. And two of those halides are necessary ingredients for our body. That's iodine and chloride. We can't live without them. Two of them we don't need, fluoride and bromide. We can certainly live without them. And I say there's no known therapeutic value of either of those two items. But our biggest exposure, I think, today is to bromide. And bromide is used as a fire retardant in many consumer items, such as mattresses and couches. It's in all the computer equipment. It's in pressed wood products. There were studies where they checked the household dust of houses across the country, and they found bromide levels very high in 100% of the samples that they tested. Now, it's not just the environmental fire retardant that we're exposed to bromide. It's in our food and drink as well. And bromide is in many Gatorade products and Mountain Dew as brominated vegetable oil. So we're not only getting it from our environment, we're getting it from our food and drink as well. And we're also getting it from bread, as it's brominated flour in much of our bakery products. Mm-hmm. So my experience of testing over 1,000 patients is they've all had high bromide levels, and generally the sicker they are, the higher the bromide levels are. And really the only way to get bromide out of the body is to use iodine and salt. And I talk about that in depth in my books, my iodine book and my book, Salt Your Way to Health.
Mm-hmm. Okay. Now, what I find amazing is that when a child is born, when a mother and father have a child, when the baby is small, they watch that it doesn't run into the street. They watch when they don't go too close to the stove to get their hands burnt. They watch a lot of things, and they also sometimes give vitamins. But what's amazing, what I see, and it's hard to convince people, because I tell people over and over again about aspartame in the soda, you know, and for some reason, people don't want to believe how dangerous that is to children and grown-ups. It's hard to convince people that our government agencies would allow something like that in something that even children drink. And it does no good. Supposedly, in my research and the different doctors that I spoke to, they all agree that it'll make you get heavier than you are. You're not going to lose weight. It'll make you hungrier. So can you comment a little bit about what's in the drinking sodas?
Well, you know, there's certainly we're eating too much sugar in our diets, and you know, too much sweetened sodas, and then the unsweetened sodas have these chemicals that make them sweet to our bodies, but they don't provide any calories, and we're told that they're safe to drink and they're help us lose weight. And the studies have clearly shown we don't lose weight when we drink these diet drinks. We gain weight because the body thinks a big load of sugar is coming in and makes it hungrier, and it disrupts the gut and throws the body out of balance. And when the body gets out of balance, it makes itself heavier to survive the toughness it's in. We need to go back to basics and eat the right foods, keep ourselves hydrated by drinking water, and stay away from soda products.
Mm-hmm. You know, it's a funny thing. I spoke to someone last night. She happened to call me, and we were talking on another subject. Then she said to me, I just got bad news. I had breast cancer, and it's the aggressive type of breast cancer. So I said, really? I says, and I didn't know this woman before. So I said to her, well, you know, what is your plan? I mean, what are you going to do? So she says, well, I have a good oncologist and I have a good surgeon. So I said to her, you know, it's just my opinion. A lot of doctors and a lot of alternative treatment doctors or people might not agree with me, but I believe what I've seen through my experience and working with people for over 25 years, more like 28 years with cancer, is that if you have the right surgeon and he takes more of the tissue out and doesn't disturb the tumor, and they take that out, it's very possible that it might not come back. So that's what I explained to her, that I think, you know, if she had, because I've seen it over and over again in different people that I know. So can you comment on that, on surgery? And
Well, I would agree with you, Sal, that I don't think it's smart to be poking needles into cancerous areas of the body to make a diagnosis. I think if we suspect that there's cancer there, or we're not sure, they should do an excisional biopsy and remove the lesion and then analyze it. I've never quite understood this needle biopsy phenomenon, and certainly for breast cancer, it's not a good way to go, as studies have shown that you can track the cancer out of the through the needle tract. And I would say if there's a lesion there, someone suspicious of, they should have an excisional biopsy and not a needle biopsy.
Well, I said this on another show, which is amazing. I had a high PSA. It wasn't high, but it was about 6. And generally, I heard of people my age in the 70s, it does go up, the PSA. It's not 4 anymore, the highest. So I went and had it checked anyway. And I went to 3 different doctors. The first doctor didn't take a urine sample. The second doctor took a urine sample, and he held it up, and he's supposed to be one of these big doctors. He held it up and looked at it, and he says, "Oh, it looks pretty clear to me." So I said, "Well, what do you suggest?" He says, a needle biopsy. So I said, "All right, let me think about it." So then I went to the third doctor, and he said, he took a urine test also, and he said to me, "We have to do a needle biopsy." I said to him, "I don't believe in needle biopsy. I haven't believed in needle biopsy since my mother died, like over 35 years ago." And he said to me, "Well, how are you going to find out if you have cancer?" So I said, in my book, there's different ways you could find out through different universities, through a urine test, whether you have prostate cancer or not. But beside that, there's also an MRI that you can test to see if you have a tumor there or not, right? So he says to me, "You can't tell with an MRI if you have cancer or not." So I says, "Well, I'll go somewhere else." I tried all over to get the MRI myself, right? Pay for it myself, but nobody would do it. You needed a prescription to get the MRI. So I was willing to go to Florida because there's a person does it in Florida. It's a doctor, and the guy calls me back, and he says, he says, "I think we could do something with the MRI." I said, "Really?" I said, "Okay." So finally, they do the MRI and all of that. It comes back, they found a sac with nothing in it, like a cyst type sac with nothing in the sac. So he says, "You have no cancer anywhere, in that area." So I'm thinking to myself, this is the doctor that told me that there's no way you can tell whether you have prostate cancer unless you do a needle biopsy. So, I don't think I think more and more doctors today are, because more and more people, because of shows like this, are not getting needle biopsies. They're looking to try and do something else. They're doing the research. Because it does spread cancer, because he said we're going to put about 11 needles in the prostate. Now, I said, "What happens after you put the 11 needles in?" He said, "Well, the blood, you do get some bleeding. So now, if you're going into cancer cells, you're going to bleed, it's going to go through your whole body." So I never got it. So anyway, can we talk now about some safe and effective natural alternatives to harmful drugs? In other words, like cholesterol is a whole nother show. It's amazing. I've had doctors with cholesterol, but I say something other than cholesterol, where they're trying to push, say a lot of people have inflammation. Now, in your opinion, are there natural drugs that people could take for inflammation?
Absolutely. I've written a book called Drugs That Don't Work and Natural Therapies That Do, and I have a long chapter on anti-inflammatory drugs and the problems with them. The number one cause of renal failure in the United States is the overuse of anti-inflammatory drugs like Motrin, aspirin, and naproxen, and the likes of those medications. For short-term use, those medications are fine if you sprain an ankle or something like that. But for any long-term use, I discourage my patients from using non-steroidal anti-inflammatory drugs and use natural things to inhibit inflammation, such as ginger, such as drinking water and just maintaining hydration. Iodine has anti-inflammatory effects. Systemic enzymes have anti-inflammatory effects. And studies have shown systemic enzymes after about 3 weeks of use have equivalent or better anti-inflammatory effects than the non-steroidal anti-inflammatory drugs, and the enzymes don't cause kidney failure. So there's many things in the natural world that we can use to prevent inflammation and get away from drugs that are causing kidney failure and stomach ulcers and a whole bunch of other problems.
Right. I since I started the show, when I did the research on my book, the number one supplement that I tell people to take, and that helps inflammation also. And talking to Dr. Brzezinski, he believes that it helps also in the brain to get rid of some of the inflammation in the brain. So I've been telling people to take turmeric, curcumin, because there's so many different things. I've seen firsthand polyps disappear after a person had it for 18 years, polyps. Every year colonoscopy. Took turmeric, gone. And the reason why I told, as a family member, the reason why I told them to take it, because I did the research, and I did find doctors that did come out and say, you know, that it helps with polyps, you know. So can you comment on turmeric and the benefits?
Turmeric is one of those natural anti-inflammatory agents that are very helpful for a variety of inflammatory provoking conditions. And I use a lot of turmeric in my practice, find it very effective. I haven't found any adverse effects unless somebody has an upset stomach to it, which, you know, is minor. But I find it a very easy thing to use and certainly could replace all the non-steroidal anti-inflammatory drugs that are out there.
You know, it's amazing. I interviewed Dr. Keneally. She's from Los Angeles. And she talks about giving intravenous, which I never heard of, intravenous intravenous turmeric, curcumin, to her patients. And ever since I heard that, I asked a few other doctors if they incorporate that in their treatment, and they do in their cancer treatment. Do you incorporate that also?
I haven't used intravenous turmeric yet.
Oh, okay. Well, that was news to me. I never even knew that exists. Now, getting back to the iodine one more time, what is the best way for a person, being that almost every doctor I talk to say they don't even bother checking because everybody's low? What would be the best way to build up naturally with iodine?
Well, I mean, the largest source of iodine is in the ocean, so ocean fish and ocean vegetables theoretically could contain large amounts of iodine if the ocean was clean. However, in areas where the ocean is polluted with bromide and or fluoride, just like our bodies, the sea vegetables and the sea animals will contain too much bromide instead of iodine. So you can get iodine from seaweed, you can get iodine from ocean fish, but it's not the best way to get iodine in the body. Best way is to supplement with a pure form of iodine, and you can use liquid iodine or you can use tableted forms of iodine, and that's what I use in my practice.
Now, how much of a dose would you say you would need to just maintain the iodine level?
So I've done a lot of research on this, and we've estimated that the Japanese ingest about 13 milligrams of iodine a day, just from all the seaweed and what they use seaweed to fertilize their plants, and what they get in their diet. So I suggest for people to take somewhere between 12 to 25 milligrams of iodine a day, sort of as a general rule, and in the form of either Lugol solution or tableted Lugol solution. And generally, if they have problems such as breast cancer or prostate cancer or thyroid problems, they may need more than that. But starting doses for most people is 12 to 25 milligrams a day of either Lugol solution or tableted Lugol solution.
Okay. Now, can we talk a little bit about detox and how important that is for the body?
Detox is very important for the body, especially in our toxified world. We're exposed to more and more chemicals at an increasing rate, and these chemicals can poison enzymes and block receptors in the body. And as a consequence of being exposed to these toxins, we become heavy and we become diabetic, and Alzheimer's and Parkinson's is related to pesticide exposure and other toxic items. So I found that, a proper detoxification plan can be a wonderful benefit to anyone's health status. And the first step is to identify what you're detoxifying from. So we do testing in our patients for heavy metal toxicity. The two most common metals that we see in the vast majority of people are mercury and lead. Either one of them is number 1 and 2. And I would estimate that well over 85% of patients are suffering from toxic loads of heavy metals, and that's not even including the pesticides and insecticides and everything else that's out there.
Mm-hmm. Well, they talk about vaccinations and autism. But I guess that's a different situation because these are babies, children that they give that to. I guess you're saying we have a lot of that in our body now. I guess it doesn't bother us as much maybe as it would through a vaccination in a young child, right?
That's correct. Babies' bodies are much smaller. Their detoxification pathways aren't as well developed. And when we inject toxins into babies, they respond very poorly to that. Our bodies aren't set up to deal with toxins in an injected form. They're set up to deal with toxins coming in through breathing or coming in through our food supply, not through injectables. And that's why injectables are so much more toxic than the other methods, the other modalities of being exposed to them.
I spoke last week. We had a show with Dr. Young, Robert Young, and he talked about 100% cure rate with his diet and all of that, supplements, diet. And to me that sounds very interesting because I never heard that before. He said at his ranch you can get 100%, not only of autism but other things. And that's through just diet alone and detox, And he says you got to go to urinate 6 times a day. You got to move your bowels very often. And that's where the detox comes in, I guess. Can you comment on that?
Well, there's no question that a proper detoxification plan can help a variety of conditions and improve nearly any. But again, the first step is identifying what you're detoxifying from, and then you can develop a treatment plan specific for that. Well,
let's talk a little bit about supplements. We talked a little bit before about turmeric. What are the, I would imagine D3 is another big one, but what are some of the other important supplements that you think a person, say without cancer, just to maintain good health, what do you think they should be taking a day?
Well, the first thing they should do is maintain adequate hydration. Too many people are dehydrated, and you can only maintain adequate hydration with drinking adequate amounts of water. And you can take your weight in pounds, divide by 2, and the resulting number is the number of ounces of water a day you should drink, is a general rule. So I always tell my patients, the basics of trying to optimize or maintain your health is to drink enough water to maintain hydration, adequate amounts of salt, because our body doesn't have stores of salt. Salt's the second major constituent in the body. We need salt to run thousands of different reactions in the body, and too many patients are salt deficient. I've been checking salt levels on people for well over 20 years, and I would estimate over 95% of people are salt deficient who come in to our office. So about a teaspoon or 2 teaspoons of unrefined salt, such as Selena's Celtic brand sea salt or Redmond's real salt, is appropriate. And the third basic step would be iodine. We found over 96% of people iodine deficient. Maintaining optimal iodine levels is right in that realm of, what do you want to supplement with? And then from that point, it depends on the testing. And, that's where you can work with your holistic practitioner to try and figure out what are you deficient in, what do you need work in, and really try and focus down on that instead of just trying to take everything at once.
Right. Oh, okay. I take about 20 different supplements each day. And I'm as healthy as could be. The only problem I have is a stenosis in the back. Now, a funny thing, I don't know if you ever heard of this before, but one way, there's a lot of inflammation there, and they like to give you epidurals. So I went online and I started looking what gets rid of the inflammation right there in that area. And they came up with infrared light therapy. Did you ever hear of that?
I have.
And supposedly,
helpful therapy, very helpful healing therapy.
Yeah, I heard that. I said, wow. You know, supposedly it makes the blood flow a lot better than it is, and it takes away the inflammation in that area, and it helps people with a slip disc, stenosis. There could be a lot of dangers to getting the epidural. That's why I tend not to take that. You know, I don't like anything foreign in my body. I don't take drugs at all. The only thing, if I have really, really a lot of pain, I'll take Tualeve. And I've been taking that for 40 years, or however long ago it came out. And, but I don't like to take drugs at all, because I tell people, you know, you take this drug for diabetes, and then before you know it, you got to take another drug because that drug caused another problem. And then that drug caused another problem. So, in my opinion, the only thing I've taken forever is a baby aspirin a day. That's the only thing I've ever taken.
Well, Sal, I would caution you on taking that baby aspirin a day.
Okay.
Aspirin is in that non-steroidal anti-inflammatory drug family. And aspirin a day has been shown to decrease blood flow to the kidneys and is one of the most common causes of renal failure in the United States. And the risk-benefit ratio of an aspirin a day in adults over the age of about 60 is much more skewed to the risk side than the benefit side.
Okay.
I don't see really any benefit of taking an aspirin a day. If you want to inhibit blood clots, take your turmeric, take your vitamin C, and maintain adequate hydration. I think that's a better way to go than an aspirin a day.
Right. Well, the reason why I took it is because I was always a believer that this thoracic surgeon told me years ago. He says take an aspirin a day because to keep the blood thin, because when it's thin, it's a lot more healthier for you than if it's thick. So that's why I started taking it. But you're right. I just found out that turmeric does almost the same thing. It thins the blood too. There were studies done that it does thin the blood, and there's probably other things that I'm taking that thins the blood also. So that's a good thing to know. Very, very good information. Okay. So we talked that's similar, like what we just spoke about is prevention, right? What other steps in prevention that you think are important that we didn't cover?
Well, I mean, we touched on, you know, eating a good diet, and certainly I can't stress enough that if you put garbage in your body, don't expect to feel good coming out of it. You know, I use the old saying to my patients, garbage in, garbage out. And, you know, one of the best steps is eat healthy food without chemicals in it, food without hormones in it, and food full of vitamins and minerals. And can be food from animal products where the animals are fed appropriately. That can be food from fruits and vegetables where the plants are raised appropriately. So I think that's a good start for everybody, and that's, you know, what I've been writing about the last 20 years.
Right. What I've told people and what's in my book, my feelings are you should get at least 8 hours or more sleep, because I think sleep is very, very important for health. You know, I'm a hypnotherapist. I've been helping people with cancer for over, like about 28 years for free. I never charged anybody anything. Matter of fact, through the years, when people couldn't afford, we used to give tapes, cassette tapes at the time. When people couldn't afford a tape recorder, I would go there in the hospital out of my own pocket, get them a tape recorder, give them one of my relaxation tapes, guided imagery tapes. And they really got a lot of benefit and with their emotions. So can you comment a little bit about how emotions can, and anxiety, especially a person with cancer, how that benefits someone?
So emotions can certainly affect how our body responds to illness and can throw the adrenal glands off kilter and, put us into a stress adrenal state. So it's very important to try and keep our emotions in check and to do, some exercising to help us release some of that pent up energy. And it doesn't have to be exercising in a gym. It can just be walking. Tai Chi and yoga can be very helpful. But I think exercise can be a big help of anyone's health plan. And certainly with following the basic steps that I outlined earlier, that can be a big part of anyone trying to overcome an illness as well as achieving their optimal health.
Right. I'm trying to think of other things I have in my book. I also have in my book that I've learned through the years that when you're driving, there's a little button that you use only especially when you're in traffic, you use the inside air. You don't get the outside air because then you're getting all the fumes, especially if you're in bumper-to-bumper traffic and you're in the middle of the summertime. You're getting the fumes coming right in the car. And 9 out of 10, you have the windows closed and you have the air conditioner on, and you have all of these fumes coming in the inside. So that's another thing that I do all the time. My family does all the time. And I notice it right away. If it happens to be on the outside air and I'm in traffic, I smell it right away. I smell the fumes. And I know, or you could smell a skunk as you're going, if there's a skunk dead in the road. So that I think is important, especially for the lungs. So I just figured I'd mention that. Can we talk a little bit about your new book? You have it there. Can you show our viewers your new book?
And my new book is The Statin Disaster. And that book just came out a few weeks ago. And it's my 13th book. And I wrote about the most prescribed drugs in the United States are statin medications taken by over 28% of Americans. And I think that drugs should be pulled from the market. I don't think anyone should be on them for any reason. And once you study the biochemical effects of how these drugs work in the body, I don't see how anyone can make a cogent argument that these drugs are beneficial to take. The best of the studies show us statins have about a 1% effectiveness in reducing heart attacks, and almost no effectiveness in changing the mortality rates. I mean, less than 1% in the most studies. So I think statins are useless medications that too many people take, and probably going to be the drugs that are most likely to bankrupt Medicare and Medicaid, for costing so much money and not giving us any benefit from them, and causing, I wish it was just that problem, but they certainly cause a lot of harm, and they're associated with serious illnesses like ALS and brain fog and dementia and Parkinson's disease, muscle weakness, and studies have even been shown that they cause heart attacks from depleting CoQ10 levels in the body. Mm-hmm. So I think that these drugs should be pulled from the market and no one should be on them for any reason. And I wrote about the history of the statins and how they came about and, why there's so many problems with them today.
We've had other shows where we've had cardiologists on talking about what you're talking about, statin drugs. And I tell a story about years ago when I had high cholesterol, doctors put me on a statin. So I was on the statin maybe for about a week or 2 weeks at the most. And what happened, I started getting pains in my shoulders and the muscle and the joints. And I said to myself, this is not working. This is not good for me. I'm not going to do this. And this is shortly after that I started taking the aspirin a day. But what I did find out with statin drugs is that cholesterol is not going to kill you. What's going to kill you is hardening of the arteries. So what I do is I go and get my carotid arteries, the aorta, and the arteries going down your legs. I go and get that checked. And I have, what a lot of people don't know either, is that there are good cholesterol, there are bad cholesterol, LDLs, and there are good LDLs. A lot of people don't even know that. The good LDLs are the bigger, fluffier particles. The ones that are going to hurt you are the the smaller ones are the LDLs that are going to stick to the arteries. So a lot of people don't know that there are also, even though your LDLs are maybe high, there might be good LDLs and the bad LDLs. So what I do, I get everything checked, and there's nothing there. I mean, there's no blockage at all. And what I've heard through different people, doctors, that if there's no blockage there, 99% of the time, there's no blockage in the brain either. You know? So do you think that's a good way of looking at it?
Well, even if there's blockage, Sal, I don't think it's beneficial to take statin medications.
Right. Mm-hmm.
I don't think that the best the studies show is about a 1% improvement in heart attack rates, but another way to look at that is 99% of people fail them who take them. And I can't understand why we use drugs with a benefit ratio like that. And then when you throw in the side effects of statins, the muscle problems and the brain problems, neurologies, and cancer rates go up for people who take statins. I can't see why they're prescribed. But there's certainly nothing wrong with monitoring and testing, and certainly a holistic approach would look at things that are imbalanced and try and correct that and supply the body with the nutrients it needs. You mentioned hardening of the arteries. One of the reasons the arteries get hardened is from lack of vitamin C, and you can't produce enough collagen to keep the arteries nice and elastic. So every new patient that comes in our office gets a vitamin C level checked, and vitamin C has no toxicity to it. I can tell you the percentage of vitamin C deficiency just on blood testing approaches about 50 to 60% of patients. That's a lot of people out there.
Yeah.
So simply taking vitamin C might be able to reverse the epidemic of heart disease that we're facing, but it certainly hasn't been reversed with statin use, and it never will be reversed with statin use once you know how the mechanism of how statins work, and that's why I wrote that book.
Mm-hmm. Well, what I generally take also, I mean, I'm learning all the time. What I generally take is Lamisol encapsulated vitamin C and Lamisol encapsulated glutathione. I take those, they come in a liquid form, and you take that with orange juice. And I had Dr. Levy, he turned me on to that. To me, I think, it's working for me. I mean, I feel more energy, and, it's really working for me. But another thing I learned I'd like for you to comment on, to another doctor we had on the show, what I never knew about, was vitamin K2 reverses plaque in your body.
Vitamin K2 is important for collagen formation and to keep that elasticity of the arteries, and it also helps prevent blood clots. Vitamin K2 pretty much comes from animal products, and if people aren't eating enough healthy foods, they're going to be deficient in vitamin K. So that can be part of a holistic treatment regimen if people are low in that as well.
Mm-hmm. Okay. Now, could we talk a little bit more? We have a little more time. Can we talk a little bit about your book and what are the important things in your book that you want to let people know what's in there?
Well, we could start with my iodine book. The book is called Iodine, Why You Need It, Why You Can't Live Without It. And it's in its 5th edition, and it describes why we're suffering an iodine deficiency epidemic and what we can do about it. But, I say that 1 in 7 women with breast cancer, 1 in 3 men with prostate cancer, and if you throw in the thyroid cancer being the fastest growing cancer in the United States, all those conditions are related to iodine deficiency. And unless we correct these underlying causes of these illnesses, we're just going to keep suffering these conditions over and over and over. And the ultimate therapy is not going to be more chemo, surgery, and radiation. It's going to be determining why we're imbalanced in these basic nutrients. And that's why I wrote all these books. My statin book was written to educate people that they don't have to take statins just because their doctor tries to convince them to. And I wrote a whole section in this book on statistics and showed how the powers that be manipulate the statistics to convince us the statins are more effective than they really are. And unless people become more educated, they follow along like sheeple and just do what they're told to do. But I don't think that's the best way to go. I think people need more education, and and they need to do more healthy things for their body. And like you said, if you get prescribed a drug for a problem, many times you're prescribed another drug to treat the problems of the first drug, and then another drug to treat the problems from that drug, and then the spiral goes on and on and on. And drugs that block enzymes and poison receptors are really not the answer for the health issues that we're facing today. The answers are to eat better, correct nutrient deficiencies, do a little bit of exercise, and maintain adequate hydration.
Mm-hmm. Okay. Now, is there anything else you want to say now? You want to just name some of the books that you have and where you can get them?
So my website, drbrownstein.com, drbrownstein, BROWNSTEIN.com. And I have books on, I have overcoming thyroid disorders. I have arthritis, a book on overcoming arthritis. I have, as I mentioned before, the Guide to Healthy Eating, a book on salt. Salt is one of the most basic items that we need in our body. And the book is called Salt Your Way to Health. I have DVDs on lectures that I've given. I wrote these books to educate people on, how they can help themselves. And I wrote it in a format that any person should be able to read and any person should be able to implement, the ideas that I recommend in the book if they see fit. And I think once they educate themselves, they'll come to the same views as I have, that we really need a more natural approach to medicine.
Absolutely, absolutely. And you can get it in Barnes and Noble, these books, and Amazon.
No, we're not in bookstores. We're really just on our website. It's drbrownstein.com.
Oh, okay.
It's just me and my wife. We've been a tag team doing these books for years, and to keep the cost down, kept them. And my wife goes to the post office once she mails them out, and we've sold over 600,000 books.
Wow.
And over the years, and I think the readers will find them very helpful.
Oh, absolutely. Can you tell our viewers what your email address, where your office location is, and possibly your phone number if they want to get in touch with you?
So they can get all the information on my website. It's www.drbrownstein.com, and it's BROWNSTEIN.com. And my office is in West Bloomfield, Michigan, and the contact info is all from my website.
Mm-hmm. Okay. So I want to thank you for being on the Health Show, and hopefully down the road we'd like to have you back again. There's a lot of questions that I didn't ask you that I would like to ask you on another show. So
well, thank you for having me, Sal. We'll do it again.
Yeah, absolutely. It was a pleasure having you here. Thank you so much.
Thank you.
So there you have it, Dr. David Brownstein. Go to his website. If you're in the area, go and see him. And there's a wealth of information on his website. So I want to thank you for joining me on the Health Show, and we'll see you again the next time.